Heartbreak to Heart, Health, the Silent Crisis Facing Black Women. Welcome to a conversation that might just save your life. Today, I'm sharing invaluable insights from my recent interview with Alisha Shack, a revolutionary force in cardiovascular health advocacy, whose groundbreaking research has transformed how we understand the connection between emotional heartbreak and physical heart health. Alicia isn't just a researcher, she's a visionary who has created pathways for thousands of Black women to reclaim their cardiovascular wellness after periods of emotional distress. Her work stands at the intersection of medical science and social justice, making her one of the most important voices in this critical but often overlooked field. Have you ever noticed how we talk about heartbreak? My heart is shattered. My chest physically hurts. I feel like my heart is being squeezed. We use these phrases metaphorically, but what if I told you that for many women, particularly Black women, emotional heartbreak can literally damage your heart? This isn't poetic language. This is medical reality, and it's a reality that's killing us silently, systematically, while we're busy powering through, showing up for everyone else and maintaining that image of the strong Black woman who can handle anything life throws at her. But here's what Alicia Shack helped me understand during our profound conversation. Our hearts can't handle everything. They weren't designed to. And the data proves it with devastating clarity. A nationwide survey conducted just last month revealed something that should shock us all into action. 1 in 3 women have never discussed heart health with their doctors. 1 in 3. Despite heart disease being the number one killer of women in America, for Black women, the statistics are even more alarming. As Alicia explained with both passion and precision, 43% of Hispanic women and similarly high percentages of Black women face elevated risks of heart disease but aren't receiving adequate preventive care or education. Let that sink in for a moment. The number one thing killing us isn't being discussed in our doctor's appointments. Why? Because for decades, heart disease has been mischaracterized as primarily a man's disease. This misconception has led to systemic underdiagnosis and treatment delays for women, particularly Black women who already face additional barriers to healthcare access. But Alicia Shack's research reveals something even more concerning. Our hearts respond differently to stress than men's hearts do. And not just a little differently, dramatically differently. Research presented at the American College of Cardiology's annual scientific session this year showed that lifestyle factors have a significantly stronger impact on women's cardiovascular health compared to men's. Women with poor health profiles faced nearly 5 times the risk of heart disease compared to women with ideal health, while men with poor health had only a 2.5 times higher risk than their healthiest peers. 5 times the risk versus 2.5 times. Our hearts are literally twice as sensitive to lifestyle factors. And what's one of the most significant lifestyle factors affecting heart health? Emotional stress. This is where the connection between heartbreak and heart health becomes undeniable. When we experience emotional trauma, whether from a relationship ending, workplace discrimination, family conflict, or the cumulative effects of systemic racism, our bodies produce stress hormones that can literally damage our hearts. For Black women, this creates a perfect storm. We're already navigating a healthcare system that has historically undervalued and underserved us. We're already dealing with the physical effects of chronic stress from racism and sexism. And then when we experience personal heartbreak, Our bodies absorb that pain in ways that can have life threatening consequences. But here's where I want to pivot from the problem to the solution. Because Alicia Shack's work isn't just about identifying the crisis, it's about empowering us to address it. During our interview, Alicia shared the inspiring story of a community in Atlanta where grassroots organizations led by Black women health advocates successfully pushed for more inclusive research and targeted interventions. These fierce advocates didn't just talk about change, they created it. They developed culturally sensitive heart health education programs that have shown remarkable results, reducing cardiovascular incidents by 27% in just 18 months. These advocacy efforts have led to policy changes in several major healthcare systems, with more providers now receiving specialized training on gender and racial disparities in heart disease presentation and treatment. As Alicia eloquently put it, we're not just changing medical protocols, we're changing medical culture. But institutional change, while necessary, isn't sufficient. We need to take personal action too. During my conversation with Alicia, she emphasized that becoming heart healthy after emotional heartbreak requires a multifaceted approach that addresses both physical and emotional well being. First, we need to recognize that our emotional pain is also physical pain. When we're heartbroken, we're not just sad. Our bodies are experiencing a physiological response that can impact our cardiovascular system. Acknowledging this connection is the first step toward healing. Second, we need to prioritize heart health conversations with our healthcare providers. Schedule a heart health assessment within the next month. Request comprehensive screenings that include both traditional risk factors and those that disproportionately affect Black women. Develop a personalized heart health plan that addresses both physical and emotional well being. Third, we need to embrace lifestyle changes that support heart health. Research shows that diet, sleep, physical activity, and stress management are particularly important for women's cardiovascular health. Small, consistent changes in these areas can significantly reduce our risk of heart disease. But here's where I want to get real with you for a moment because I know what you're thinking. I don't have time for this. I'm already juggling too much. I can't add one more thing to my plate. I hear you. I see you. And I want you to hear what Alicia Shack told me during our interview. Taking care of your heart isn't adding one more thing to your plate, it's making sure you're around long enough to enjoy the feast of life. That hit me hard. Because how many of us are so busy taking care of everyone else that we forget to take care of ourselves? How many of us are so focused on being strong for others that we neglect our own strength? How many of us are so accustomed to pushing through pain that we don't recognize when our bodies are crying out for help? A groundbreaking study published just last week examined outcome for patients undergoing advanced cardiovascular procedures, revealing significant disparities based on both gender and race. The research found that women face an 8% higher risk of major complications following certain heart procedures compared to men, while Black patients showed significantly higher risks of serious complications, including amputation and death, following procedures to restore blood flow to extremities. These findings come after decades of cardiovascular research that primarily focused on male subjects, leading to treatment approaches that may not be optimally suited for women's unique cardiovascular physiology. But the medical community is finally acknowledging these long standing disparities. The Society for Cardiovascular Angiography and Interventions is now advocating for more inclusive research protocols and specialized training for healthcare providers to address these disparities. Several major medical centers have implemented new protocols specifically designed to improve outcomes for women and Black patients undergoing cardiovascular procedures. This research is driving a fundamental shift in how cardiovascular care is delivered, with more personalized approaches being developed to address the specific needs of women and Black patients. But we can't wait for the healthcare system to catch up. We need to be our own advocates now. As Alicia Shack powerfully stated, your heart is the drum that keeps the rhythm of your life. You wouldn't ignore a broken drum in an orchestra, so don't ignore the signs that your heart needs attention. The findings from Alicia's research have led to the development of new screening tools specifically designed to assess women's cardiovascular risk, including AI powered mammograms that can detect breast arterial calcification as an early warning sign of heart disease. These advances are changing how healthcare providers approach preventive cardiology for women, with a greater emphasis on holistic approaches that address both physical and emotional aspects of heart health. But technology alone won't save us. We need community, we need connection. We need to break the silence around heart health in our communities. Start conversations with the women in your life about heart health. Share what you've learned. Encourage each other to get screened. Hold each other accountable for making lifestyle changes that support heart health. And perhaps most importantly, challenge the narrative that Black women must be strong at all costs. Strength isn't about enduring unnecessary suffering, it's about having the courage to prioritize your well being, even when society tells you that your pain doesn't matter. Your pain matters, your heart matters, your life matters. I stand before you today, not just as a speaker, but as a witness to the power of transformation. Alicia Shack's work has shown us that the path from heartbreak to heart health is not just possible, it's essential. And it begins with a single courageous step, acknowledging that our hearts deserve the same care we so freely give to others. So I challenge you today, will you make that appointment? Will you have that conversation with your doctor? Will you commit to one small change that supports your heart health? Will you share what you've learned with another woman who needs to hear it? Because this isn't just about living longer, it's about living fuller. It's about ensuring that the organ that feels so deeply can continue to beat strongly. It's about transforming the way we understand strength from endurance at all costs to wisdom that knows when to rest, when to heal, and when to ask for help. The revolution in Black women's heart health begins not in medical journals or hospital corridors, but in this moment, with your decision to value your heart as much as it values you. Your heart has never stopped fighting for you. Today is the day you start fighting for it. Thank you.